I was trained as a family medicine doctor here in the United States. So as part of my residency training, I learned comprehensive reproductive health care, including abortion provision, but it wasn't a subject that I was necessarily really passionate about or invested in. My passion at that time was actually high-risk obstetrics, taking care of high-risk pregnancies. One of my first experiences, I was working in Lesotho on the maternity ward in a small hospital in the mountains. And one day, this 18-year-old girl came in and she was just very sick. She actually had septic shock, which is a state of like a full infection in the body. She was in and out of consciousness and had a really high fever. And when we examined her, we found sticks and leaves inside her vagina. And it was immediately clear to the staff and then to me that these were the complications from an unsafe abortion that she had tried to provoke at home. And it took days and days, but she did ultimately recover. But I remember sitting by her bedside and thinking that this was all so preventable and avoidable. When I was on my first assignment with MSF in the Democratic Republic of Congo, I was also in charge of the sexual reproductive health activities for a pretty large project. And being in charge of the maternity ward, I actually saw women and young girls who were just as sick as that girl in Lesotho, but now it was bed after bed after bed with women with complications from unsafe abortion. I just remember walking through the wards where we were admitting 800 women a year with post-abortion complications and seeing all different types of women in the hospital beds. Young women, old women, unmarried women, married women, women with kids, women without kids. The one thing that they had in common is that they were people with unwanted pregnancies who were looking for a way to safely end their pregnancies, but they didn't have access to safe medical care. So they resorted to unsafe ways to end their pregnancies. For me, this was very new, and I was witnessing this for the first time. But when I would speak with the local Congolese staff, the midwives that were working in the hospital and the other doctors, for them, it had been something that they had seen and been treating since their training. What became really apparent also was that they had a lot of personal stories to share, and they had been personally impacted by women in their lives that they knew that had had complications from unsafe abortion and had died as a result. So sometimes it was the story of a sister growing up, or a neighbor, or a classmate from nursing school. One staff even told me about his daughter who died from an unsafe abortion. That whole experience really opened my eyes to a whole world of suffering for women and girls that I had never known existed before. Now that I've been working with MSF and I'm seeing these women with my own eyes and I've held their hand beside their beds, I understand abortion as a medical necessity. I know that providing safe abortion care saves women's lives.